healthy patient from a medical standpoint. The periodontal situation is healthy. She's a young patient with no evidence of periodontal issues. Now, as you see, I'm going through these, what we call general modifiers, and on the right-hand side, these are listed now, and you can't see the color so well, but in yellow and green. So green is the low level of risk, yellow is a high level of risk, and red is the highest level of risk. All right? So the patient has good oral hygiene and is a non-smoker. And the 24-year-old has completed growth, because this has implications. So now I go into, past the general issues, I go into the basic indications. She has a single tooth gap that needs to be replaced, and it is visible when she smiles. So immediately there is an aesthetic concern with this patient. And we see she fully exposes the gum line, and her teeth are fairly low and thick in terms of the gum, and they are rectangular in shape. So these are just the clinical issues. Now, she has definitely got infection, and the infection is acute. There's swelling and pus discharge, all right? And the bone levels are favorable. The adjacent teeth have been restored with crowns as well. The space is symmetrical, and the soft tissue anatomy is defective because of the infection. And we are definitely not placing this implant at the time of extraction because of the infection. So we click on no here. And we anticipate when we go back in and do the surgery, because of the infection, we will have to build up the bone because of the infection at the site. So we're going to be horizontally deficient, requiring simultaneous augmentation. And when the implant's placed, we're not going to put a crown on the implant straight away. It's too risky. So we will go for an early loading protocol some months later. And now we have a generation of the SAC classification. So the SAC classification is advanced. So if you're a clinician and your skills are only up to the level of treating straightforward cases, immediately this case is too difficult for you to treat. Or if you're in a postdoc program, the supervisors will say, no, this case is too hard for you to treat, because there are too many risks of things going wrong because of your lack of experience and ability, and the risk ultimately becomes the patient's problem, becomes the patient's risk.